So, you're on the case. On the prowl. Out for clues. A flatfoot. A gumshoe. A sleuth on the loose. Yes, well, the point is that you know what to look for when you're tracking down a headache. But that doesn't mean you don't need some assistance along the way. Why, look at your trusty sidekick. Where would you be without him? He keeps you from peril and steers you away from misleading information. He keeps a constant vigil by your side. And just like the best assistants, we're here to help you with a peppy mnemonic that will help you remember the signs and symptoms of a secondary headache. Mnemonic, to help you remember. It's an acronym. And that acronym is SNOOP. Here's how it works. S. Simply put, the S represents systemic symptoms and secondary risk factors, such as weight loss, fever, and systemic illness. N, for neurologic signs and symptoms that are new. That might mean altered sensorium or changes in consciousness, always a cause for concern. For example, sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Or confusion, trouble speaking or understanding, trouble seeing, in one or both eyes, lack of coordination or dizziness could all be signs of stroke. Some of these symptoms also overlap migraine symptoms, and many migraine patients fear that they are having a stroke. Next up are the twin O's. The first stands for onset, the most important characteristic of the headache to evaluate. Remember that patients with a sudden or abrupt headache that peaks in seconds or minutes need careful assessment to rule out subarachnoid hemorrhage. The second O stands for older patients over 50. Remember that any new or progressive headache that begins in middle age should be tested, and older patients are more likely to have comorbid disease. In the elderly, giant cell arteritis, or GCA, should be considered. And finally, we come to P. The letter P. For progression or change of past headache. Any new headache that is significantly different from a previous pattern should be investigated further. That means any headache that is different from usual headaches in frequency, severity, duration, or other clinical features. And there you have it, an acronym to help guide you as you go about solving the case, making the diagnosis. SNOOP, committed to memory and happy hunting.